How was it for you working during the pandemic, really?
It was quite scary seeing patients in their last days and almost being the only person that would be there for them, like the medical team and the nursing team.
Has there been any life-changing moments for you?
I think working with children is such a privilege, but you can see some really sick children, whether they were well and they've become sick very quickly with like an acute situation. You see parents who have very normal lives and they have an unwell child, and realising the impact that has on them as well. Anything could happen at any point. You would hope that as a female doctor you would earn the same as a male doctor, even in the future, even in 10, 20 years' time. But unfortunately, the evidence doesn't show that. And there's a roughly 18% pay gap between male and female doctors. I've had times where I've seen patients, I've examined them, ordered their investigations, told them the plan, written their discharge letter, and they've said to me, when am I seeing the doctor?
Did you get any hatred?
There was one message I got once that made me cry multiple times. People were like, oh, you're just trying to show off that you're a doctor.
Dr Radhika, welcome to Figuring It Out. Welcome to the podcast on a bright sunny day in London. We're both dressed in our summer dresses, So that's exciting. Welcome to the podcast. How are we feeling today?
I'm good. I'm really excited to have a chat with you. Thank you so much for inviting me. I'm excited to get into the questions.
I'm excited to get to know you too. And equally, I think we've tried to meet twice or three times.
Yeah.
We managed to finally have a date. So I'm very excited for this. Can we start with having an introduction? Who's Dr Radhika?
I'm Dr Radhika. I am a paediatric doctor and I'm based in London. As well as being a doctor, I'm a bit of a content creator. I post about life as a doctor on Instagram and TikTok and a little bit on YouTube as well. And I generally like to post content about what life as a doctor is really like, things that I would have liked to have known when I was younger, but now I know it. I'm kind of giving that advice to younger people, younger doctors particularly. I'm also British Indian. I'm vegan. I love cycling. I've been living in London for 10 years, so I think I can say I'm a Londoner. I just generally tend to be a happy person.
I love the bit where you went on to your hobbies and what you actually like, that you're vegan, you like cycling. Because I think so many times we ask people what do you do? Or tell me about you. And it's always about the professional journey. This is what I've done. This is where I'm working. Love that. One of the things that I really resonated with you, which is also why you're here, other than a great referral from Josie. We've both been on her podcast in the past. But I really resonated with your Instagram version, or rather the unfiltered version. As someone who works for the NHS, you very proudly shows the behind the scenes, the ups and the downs. And I think that's one of the things that people really connect with you. Can we talk about the actual struggles working for the NHS?
Yeah, that's something I'm really passionate about sharing, because I think, especially when I was a medical student, I didn't really know what to expect about life as a doctor. And to be honest, there are a lot of things I experience now that are much better than I expected. I kind of thought I'd never get to go on holiday, and actually I do get to go on holiday. I get annual leave and I get to enjoy my holidays. But there are definitely struggles within the NHS. Part of that is the NHS and part of that is being a doctor. So if I think about things that are difficult about being a doctor, the long hours are always difficult, the shift work, night shifts, weekends. It's something I've gotten used to. Now I'm in my 6th year of being a doctor. Mm-hmm. But I think especially when you have to miss family events or friends events, or you even if it's like a spontaneous meetup, but you can't go because of your shifts, whereas it's on a Saturday and everybody else is free, that can be really difficult sometimes. And I do work really hard to try and make sure I can go to most things, and I swap shifts around and things, but that can be really difficult. I think in the NHS itself, one of the really difficult things is kind of balancing the demand and what we can provide. For example, patients who have mental health struggles is becoming more and more of a issue, yet we don't always have the resources that we can provide our patients. And unfortunately, sometimes these patients only get any treatment or intervention once they're at a crisis point. And that can be really hard, especially as a doctor, where you want to be able to provide resources or referrals for your patients, but you can't because there's just not enough resource out there. Another really important thing and a topical discussion point at the moment is junior doctors' pay. Mm-hmm. So I'm sure you've heard about the junior doctor strikes. And essentially, junior doctors are facing a 26% real terms pay cut compared to 2018. So essentially our pay has not really increased in comparison to inflation and in comparison to other professions' pay. And that's why so many doctors are finding that the pay is so poor and the working conditions can be so difficult that it's almost not worth it. I know a lot of people have moved to Australia because the pay is better, the working conditions are better, and it's not sustainable, the rate of pay at the moment. I think that sometimes even at work, like, it can be really difficult, really long hours. You don't have time for lunch. You don't have time for a break. You don't have time to even drink water sometimes. And it can just be so busy. And then when our pay doesn't reflect that, and the things that we're doing, the type of patients we're looking after, the things we see day to day is just so much more mentally taxing compared to most other professions. The pay should, I personally think, reflect that as well.
I agree.
So those are some of the difficulties. Also within training, there are some difficulties at the moment with like bottlenecks in training. For example, lots of people want to be neurosurgeons, yet there aren't enough neurosurgical training jobs. But to be honest, even other specialties like GP this year, there were thousands more applications than the number of posts available. So there are qualified doctors who want to go into a training specialty, but there aren't enough funded training positions for that many doctors. So then you have people who are passionate and driven and want to do a specialty, yet they can't get into it because of the number of training numbers. And that all essentially comes from the government and how many training numbers are available. But it's a real shame because the doctors are needed, then the training jobs are needed, and the doctors are there. But unfortunately, there's a mismatch in the training positions available. Yeah.
How was COVID for you as part of the NHS? And for people not from the UK, we're talking about the National Health Service.
Yeah.
How was it for you working during the pandemic, really?
Yeah, it was really hard. So I was in my second year of being a doctor at that point, and it affected me and it affected us in lots of different ways. I think the biggest thing was just seeing these unwell patients and knowing that you were putting yourself at risk. I was, especially at the beginning when no one really knew what to expect with COVID. And then I was working in A&E at the time. So I would be one of the first people to see these patients, and you wouldn't even know at that point if someone had COVID or not, if a patient had COVID. So it was quite scary, especially at the beginning when we didn't know what to expect. And then seeing really unwell patients coming in, especially elderly patients who might have been at home for a while. And then once lockdown started, you had elderly patients who were on their own at home and they wouldn't come in until they were really, really sick. And it was really hard seeing these patients be so unwell. And sometimes, again, we didn't have the resources to be able to look after them as well as we would have liked to because the demands on the NHS were so high at the time. And then from another perspective, being away from my friends and family, like I had friends who were really enjoying lockdown, getting to spend lots of time with their parents, go for walks, bake bread, do lots of really nice things. And I basically was in a flat on my own, and the only people I saw were my patients or my colleagues. You couldn't hang out with your friends, you couldn't see your family, you just FaceTime them.
Especially for being so much in contact with patients at the NHS.
Yeah, exactly. So you couldn't see family because of lockdown, but then also when there was a point where you could start seeing people, I would be scared to see some relatives because I was like, I don't know if I have COVID at the moment, so the risk is too high for me to see someone. So it was quite isolating, and that was quite difficult as well. Yeah, and it also affected our training because which is a much minor point, but it did affect our training because we weren't allowed to change our rotations, which we're normally meant to do. So I was meant to have an obs and gynae rotation, but instead they said actually everybody has to stay in the rotation that they're in for the full, I think it was 8 months instead of me having 4 months of A&E and 4 months of obs and gynae, which did affect my training because I didn't get that exposure to a different department. So it affected doctors in a lot of different ways. And there are probably, I know some of my colleagues and some of my medical friends had even harder experiences, like working on the medical wards, working on respiratory wards, seeing patients in their last days and almost being the only person that would be there for them, like the medical team and the nursing team. And then when their families couldn't come in either, I think it took a real mental toll on a lot of NHS workers. And probably not something that we've fully, it's not something we've fully acknowledged yet, the impact that COVID had. And I think a lot of people have kind of just...
seem to have forgotten.
Yeah, forgotten it. And I think a lot of healthcare professionals have kind of put it in a box and just kind of left that.
Parked it.
Yeah, whereas actually it was a really, really difficult time.
It almost feels surreal now.
Oh, yeah.
Talking about the pandemic, which was a bit less than 2 years ago.
Yeah.
The whole aftermath, and I do wonder one day we'll be telling our kids there was a time when people couldn't go, the whole world was locked. It seems kind of
like a dream or like a movie.
Like a movie.
Yeah.
you're a pediatrician, and so you work with children, younger people, and like with all patients, I'm sure you're probably dealing with some acute cases, talking with families. But I do wonder, working with kids and working with younger children, how does that shape your thinking, your view, your perspective about life? Has there been any life-changing moments for you?
That's a really good question. I think working with children is such a privilege, and I'm really honoured and grateful to be in the position that I'm in. I think you really see a huge variety of patients. You see like what we call the worried well, where you have a well patient but the parents are worried or the patient is worried, which is completely fine, and we provide reassurance. But you can see some really sick children, whether they were well and they've become sick very quickly with like an acute situation, or children with like complex health needs, chronic conditions. You see such a huge variety. And I think what it's really changed in my thinking is just how valuable life is and how much it can change quite quickly. I think that's true of any kind of doctor. When you really see unwell patients at their most vulnerable, and you almost have the privilege of being a person in that point for them, it really does change how you view your own life. Because even small things like being grateful that I get to come here today, being grateful that the sun is shining, being grateful that I could walk here, those are the sorts of things I feel definitely much more grateful than before, when I was at medical school, because you see how quickly things can change. And I've seen some really, really sad cases, and I think it just really reminds you to value what you have. And I think with children especially, I think you see parents who have very normal lives and they have an unwell child, and realizing the impact that has on them as well. Again, just reminds you to be even more grateful for what you do have, but also mindful that anything could happen at any point.
I actually came across this lady. She's an author of a book. It's more of a monologue. Bronnie Ware. She's written the monologue based on her own experience as a carer. The book, I think, is called like the top 5 regrets of the dying, because she's been spending a lot of time with people almost in the last days. I'm yet to read the book. She was a guest on someone else's podcast and I was listening to it, and I do plan on reading the book. But then of the 5 regrets that she said the dying had, one of them was, I wish I still kept in touch with older friends or had seen more of my friends. And then the second one was about, I wish I lived a life I envisage for myself and not what others envisage for me. And which brings me on to one of your videos on Instagram. I think I probably came across your page at that time where you were talking about going for interviews. So I don't know if that was you trying to change jobs at that time. I'm not part of the medical field, so I don't really know how it goes with trying to maybe change, because I suppose you'd still be a pediatrician, but probably try to change the location of your hospital. I'm not sure, but we can get into that. So you were trying to apply for different jobs at that time, and then you were very open about the pay and about your failures. Can we get into that? Why do you feel it was that important to be vulnerable and open about your failures?
Yeah, so just to give a bit of context to that, so I'm in my paediatric training, and that you go from ST1, specialty trainee year 1, to ST7, and then you become a consultant. So you essentially go through every year.
That's many years.
Yeah, 7 years of training. Yeah. So you go through your every year of training until you become a consultant. But I was applying for a job to take an out of program year. So basically to do something a little bit different. So I wanted to do an extra qualification called a PG Cert in medical education. And I was applying for jobs that would be like part of the time would be clinical, like working on the wards or working in an A&E department. And the other half of the time would be a funded postgraduate certificate in medical education. Obviously, I'd have to do the work. So it's not it's kind of like an extra degree. And for ages, I told myself I wanted to apply for these things. And I'd seen like older colleagues and senior colleagues do them. And I was like, yeah, that's what I want to do when I get to that stage of my career. And I ended up having 5 interviews. And after the first interview, I thought, oh yeah, that was great. Like, I think I did really well. I'm just waiting for them to call me to tell me that I got it. And then they called me and said, oh, unfortunately, you didn't get the position. And I was so upset. I think partly because I was quietly confident that I thought I had done okay. But also it was just the rejection of it all. I think especially as medics, we don't face that kind of rejection that frequently, because especially because our training tends to be, especially if you're in a training program.
Already.
Yeah, and our training tends to be quite automatic. Like once you're in a training program, the years kind of just continue. But so you don't have interviews that frequently. So facing the rejection of that interview was quite hard for me. But then I did actually learn quite a lot from it. And I did, then I had other interviews, and there was, so like you mentioned, I then had another interview for a job and I was offered the job, but the pay wasn't that great. So I ended up rejecting that. And then I had a few more, and I did actually end up getting offered one, which is I'm really happy about, and I'm really excited that I'll be doing that from September. But I felt it was really important to share because there's a few reasons. One is that I know that a lot of other people could resonate with it, especially medics. And actually when I shared that, people did message me saying, thank you so much for sharing this. Like, I'm going through something similar at the moment. I'm trying to apply for different training jobs and I failed, or I was rejected. And seeing you also talk about it has reassured me. And that's something that I really try to do on my Instagram. I try to not just show the good sides. I try to show the negatives and the difficulties as well about being a doctor. And also I just felt it was really important to be vulnerable and to show that side of being a doctor, not just showing the good sides. So yeah, I think people really appreciated the honesty in that. Also the learning and reflection of kind of failing once, but actually then learning from that and working out what could I have done better, how can I improve. That also really helped me, because then when I had the next interviews, I was more confident. I knew what I needed to work on. I knew how to better answer different questions, and I also prepared a lot more than I had for the first one. So that was also really helpful, because I think it's easy to see failure as a failure, but actually I've realised as I've gotten older that learning from the failure is also really important, and learning from it, reflecting on it, and then changing how you do things in the future is really important. And it's part of life. Like, you're not going to get everything you want first time, but then if you are able to reflect on it and learn from it, you can apply that to make yourself better, or to do better, or to get the thing that you wanted to get in the future. And that's kind of what I experienced over those 2 months of applying for interviews. I found it really helpful to learn from the failure. I was obviously sad, but then I learned from it and improved myself, which eventually led to what I wanted.
I know everyone talks about failures, and that you do learn more from failures than your successes. If you were given a chance to re-go through this whole journey, including the failures, would you still?
Yeah, absolutely. Yeah. That's a really good question. There are a few things along my medical career that I have failed at, or that haven't gone to plan. And I know that at the time I've been really sad. Even they're not small things, but like I wanted to work in North Central London, and I didn't do well enough in the way that they choose where you go. I didn't do well enough, so I ended up in South London. And I remember being super upset at the time. This was when I was finishing medical school and going into my medical training. I was super upset at the time, and I thought, oh, you're not good enough to get your top choice. And, you know, I don't know, I was just really hard on myself. And actually, I still did well enough to be in London, and I really enjoyed my training in South London. I've made lifelong friends, and I've had a really good time. I've had really good training. So I'm actually really glad with how that went. And even when I think back to applying to medical school, I applied to 4 medical schools, and I ended up going to my top choice, which I never ever thought I'd even get into. And I didn't get interviews for the other 3. So I remember being so upset at those 3 rejections. But actually, then I ended up getting an interview and an offer from my top choice. So although I have had failures and rejections, I definitely think that they've shaped me into who I am today, and I wouldn't change any of it. I don't think I would change any of it, no.
I love that. I think the reason I do ask this, because I do ask myself the same question, and I think for me, yeah, maybe the professional education part of it, I wouldn't change anything. I know everyone says, yeah, we'll go for, I have the same thing, I would never change anything. I don't know. I feel like there would be things I would still be changing, which is why it's really refreshing when someone says, no, we'll have it the same. And I'm like, oh, I don't know if I'd feel the same. I think there would be things I'd be changing. So
yeah, I just feel like I'm pretty happy with where I am in life right now. And I'm very fortunate to be in that position. But I am quite content with how my career is and my personal life. So I don't think there is anything I would change.
Ah, amazing. Love that. I really want to touch on this because in your podcast with Josie back then, when I listened to it, and I was actually listening to the other episodes, and that's how I got to know you, you mentioned pay, or the gender pay gap within the NHS, which for me was quite surprising. And I know some people might listen to this and go, well, gender pay exists, like, why are you so surprised? In the corporate field, I've pretty much heard about it. when it comes to the STEM professions, we do hear about more the gender disparity, maybe not necessarily pay, and I'm sure that exists, but about the number of men and women themselves like getting into those positions. I was a bit surprised by gender pay, or rather the gender pay gap within the NHS. And it sounded like you were also surprised to find that there is a difference between what you and your male colleague would be getting paid.
Yeah.
Can we touch on this maybe?
Yes, there has been a study a few years ago that the BMA did, the British Medical Association, and they looked into the gender pay gap with all hospital doctors, and there's roughly 18% pay gap between male and female doctors.
The same position?
Well, not necessarily the same position, but in general, so this was for all hospital doctors, male and female doctors as an 18%, and I think GPs it was 15%. But the reason so I was really surprised to hear this because I did not expect there to be a gender pay gap at all. A lot of our pay is based on like the number of hours we do, the number of out of hours we do. But I think when it gets, a lot of this is skewed by the more senior positions. And when it gets to more senior positions, there is a pay gap, or at least that skews the pay gap. And that's even when they factor in, so a lot of that is down to the fact that women tend to take on more caring responsibilities, whether that's for children or other family members, and tend to then be less than full-time. So that's our medical way of saying part-time, not working a full-time rota. But even when they factor in and adjust for less than full-time working, there is still a gender pay gap. And the paper I read essentially says it's partly down to, by working less than full-time, the career progression isn't as fast, and then that also means that male doctors who are working full-time are then more likely to hold more senior roles. They tend to be older, so then they tend to have more experience, and then they tend to hold more senior roles, and then also tend to be paid more than a comparative female. And yeah, I was just super surprised to hear this because it's not something I expected in the NHS, but there is very clear data to show that there is a gender pay gap, and I think there is work being done towards it. But I think they need to update. It said in the paper that there hasn't been a recent look at it, but there is definitely work being done to help close the gap. But it makes me quite sad to know that there is one, because you would hope that as a female doctor you would earn the same as a male doctor, even in the future, even in 10, 20 years time. But unfortunately, the evidence doesn't show that.
Yeah, I think for me the surprise was more, I suppose as a GP, your level of responsibility would be the same to another male GP, like a female GP versus a male GP. So I think I was kind of compare it to other fields that I'm probably more familiar with, where we do hear of the gender pay gap. And there's a lot of work being done to make it more transparent. I mean, banking institutions in general have signed the gender pay gap charter, where they do have to disclose salaries and senior women in positions versus male in senior positions and all of that. So I was a bit surprised by that. I'm going to ask you a riddle that I've been asking my friends. I don't know. I feel like you might get this. But anyway, I'm going to ask you a riddle. Yeah. And for anyone listening to us, they can pose this and try to guess the answer and then watch eventually what we were about to say. So the riddle goes, a father and a son are traveling together in a car. They meet with a horrible car crash. The father dies. The son is rushed to the hospital. The surgeon looks at him and says, I can't operate on him. He's my son. Can you explain?
Yeah.
How is that possible?
I've heard this one before.
Okay.
Because
we're going to pose and we're going to let everyone guess. What do you think? I'm sure you know the answer.
No, it's a great riddle, and I think I struggled with it the first time I heard it.
Did you? I struggled so badly with it.
But it literally shows our unconscious biases that we have. But essentially it's because the child's mum is the surgeon, because women can be surgeons just as much as a man can be a surgeon.
When I got asked that riddle, and this was from a friend who actually took that at work, it was part of some DEI training, and it was part of making you realize your gender biases. And I struggled so much with it. I was like, how's that possible? And for me, it was, I think I came up with, it might be because he was the biological father and he was the biological father, he was the adopted father. Or I think I said something like maybe the mom had a second husband. My friend told me, I think he was like not only can the surgeon not be a woman, now the woman has cheated. And I actually went along asking quite a few friends that riddle, and I looked it up apparently, and it's a very wide range.
Yeah.
And obviously super, super wide, but 40 to 75%, and that's a super wide range, but 40 to 75% of people get it wrong.
Yeah.
And it just makes you, like, it's a very provocative riddle where it makes you realize, like, some of your gender biases.
To think that you found it so difficult that you thought there must be two dads or maybe like a gay couple or something, that's how much you struggled to really think, actually, the mum could be the surgeon. That just shows how much unconscious bias we have. And, like, I have some friends who are surgeons and they are amazing surgeons, and like female friends, and I just know that I know how much they struggle day to day with the unconscious bias of being a woman in surgery. Already being a female doctor has so much unconscious bias. Even like when I see patients, I know that they probably have to double take when they see me as their doctor, and I literally have to say, I'm Dr Radhika, I'm looking after you today, because I feel like they might not think I'm the doctor. Actually, I've had times where I've seen patients, I've like examined them, ordered their investigations, told them the plan, written their discharge letter, and they've said to me, when am I seeing the doctor? Yeah, it happens. Or there's times where people assume like I'll have a male medical student with me, and even I'll have nurses who I know, and the nurses will go up to the male medical student and say, oh, doctor, can you prescribe this for that patient in Bay 3?
Even the nurse.
Yeah, and I'm like, you know me, we've worked together. Why do you not realise that you could have, like, I'm the person you should be asking? But it's really difficult sometimes. And to be honest, I sometimes catch myself also doing it. Like, I think I read last week someone saying, oh, Professor Smith, let's say, this patient is under Professor Smith. And in my head,
it's a man.
In my head, I immediately thought Professor Smith must be a man. And then I was like, no, it could easily be a woman. And I've said it to patients too. I've said that, like, I'll see a letter from their GP and I say, oh, you saw your GP. What did he say? And they say, oh, she said. And then, and I have to catch myself that I actually also sometimes do it. And I'm a female doctor. But yeah, there is a lot of work to be done on the unconscious biases in medicine. But even if you were to ask children to, I think there's a study where they ask children, they show a picture of a woman and a man in scrubs, and I don't know the figure, but like 70% of the children think the man is a doctor and the woman is a nurse, when actually they could be either way round. And nurses are incredible. Like, don't get me wrong, they're amazing at their job, and they do. I think I would struggle to do a lot of the things that nurses do. But when a patient doesn't realize that you're the doctor, it can be really tiring. And also, like, patients need to know that they're seeing the doctor, because then they just think they haven't been seen. I've literally seen patients say, oh, the doctor didn't see me today. And I look in the notes, I can see the doctor saw them today, but it was a female doctor, so they just thought that the doctor hadn't seen them today. Right. But yeah, that's a very good riddle. And it definitely allows you to reflect and think about what your unconscious biases are. And I'm glad that they're using that kind of thing in diversity and equality training.
And I actually asked a few other friends, like you said, you struggled with it the first time. I'd like to think you and I being here having this chat was somewhat more plugged in than maybe other people.
Exactly.
Like, we're somewhat more aware of gender pay, gender biases, and still we struggle with it, while it should have been more of a gender neutral term.
Exactly.
As a surgeon.
I hope that in the future, someone who is 5 now will not struggle with that question, because they'll see that actually men and women can easily be the surgeon. But there's definitely work to be done to help address that.
When you reflect on your experience about being treated somewhat differently, not in all occasions obviously, but because you're a woman and sometimes you are with a patient, and despite having had the conversation, having had the assessment, they still want to see the doctor. The fact that you're female is one thing. Do you think the fact that you also look young and we're South Asians, do you think that adds up to it?
Oh, 100%. Yeah.
Oh, really?
Yeah, I definitely do. I think that because I'm a Asian.
I mean, it's a compliment.
No,
but
it's
obviously
fine.
Sitting here, someone could easily think you're like, I don't know, just graduated,
100%.
right?
Yeah. I'm aware of that. And I sometimes, like, I don't wear my glasses at work because it makes me look younger. I actually went to the opticians today, and the optician said to me, why do you not wear your glasses more? And I was like, I'm a doctor. They make me look young. I have to look older at work. Otherwise people might not necessarily listen to me or trust me. I do think that being Asian, looking young, and being a woman are all things that act together. It's the kind of intersectionality of feminism, isn't it? So they do all play a part, but I also know that my Caucasian colleagues, female colleagues, also do experience it and do feel similarly. And equally, I know that Asian men might not necessarily experience the same things that I do, but also might. I think it's very dependent on where you work as well. I think being in London, I've been more fortunate to not experience it as much as if I worked somewhere that wasn't as multicultural. But yeah, I do think they all interplay together. And then I also have to acknowledge my privileges. Like, I speak English as my first language, and that definitely helps, whereas there are lots of international medical graduates, and I know that they struggle even more with building that patient-doctor relationship and gaining trust from their patients because English isn't their first language. And there are also lots of other things that they struggle with, like culturally, working in the NHS, being in England, that make a difference as well. But so yeah, I have to acknowledge that. I have to acknowledge, I'm a straight woman. I have a friend who is trans, and they definitely have situations that they struggle with, especially when people misgender them. I'm able-bodied. I've seen doctors in the hospital who need to use a wheelchair, and that obviously has an impact as well. So as well as having the things that I struggle with, there are also privileges that I have to acknowledge in this conversation as well.
Did you always want to be a doctor?
I think I don't know about always, but definitely when I was in like my early teens, I definitely wanted to do something in healthcare. I can't remember when I was really young what I wanted to do, but my mum has a photo of me with a stethoscope when I was like 4. So I don't know if that had an impact, but none of my family members are doctors. People always think that, one of my parents must be a doctor, but I'm the only doctor in my family other than one cousin who I have is a few years older than me. But other than that, no, I think when it got to like choosing my A-levels, I had a really good think about what I wanted to do, did some work experience, and yeah, I'm really glad I decided to do it. But it's definitely different to how I expected, in a good way and a bad way, but I enjoy it more than I expected to. I think especially at medical school, I wasn't entirely sure if I would enjoy it. I thought about quitting a few times because I found medical school really difficult, but I definitely enjoy it more than I thought I would. Obviously, there are challenges and difficulties as well, but I feel very privileged and lucky to be in this position. And I know there are people that don't enjoy being a doctor. I know there are people who probably think that I probably just have an easier job, or compared to their medical job, or maybe I just have been lucky to work in nice hospitals or whatever. But I don't know. From the experiences that I've had, I really have enjoyed my training, have enjoyed working, and generally enjoy being a doctor. Obviously, there are hard days. There are certain rotations and jobs that I haven't enjoyed as much. But overall, I like it.
And where does the whole Instagram, YouTube, where does that come from? At what point did you decide to go public on social media?
So I actually started my Instagram when I was at med school, and it was initially just a vegan food page. It was called Veggie Rad. So actually it started as a vegetarian food page, and then I turned vegan, and all I really did was post about food. But then over lockdown and over the pandemic, I realised that I actually really enjoyed talking about life as a doctor. People were interested to know about what it's like to be a doctor, especially at that point. And I realised that it was better than I expected in a lot of ways, and I wanted to let younger versions of me know that. So people in medical school, people applying to medical school. So then I changed it to be a more doctor-focused account, and I changed my handle to Dr Radhika. And yeah, now I just post. I really enjoy posting on it. I post on it really regularly. I really enjoy talking about life as a doctor, talking about things that aren't necessarily to do with being a doctor, but just showing people that you can be a doctor and you can do other things, have a life, go out, go on holiday. You can be a well-rounded person. It's not just hospital, work, patients. There's more to being a doctor than just that. And it's really important to think and talk about work-life balance, because it can be a really taxing job emotionally, physically, mentally. And actually work-life balance is something that people are talking about more and more, especially in doctors and in medicine. But it's really important to have that balance so that you can, my mum always says, how can you look after your patients if you don't look after yourself? And I've been thinking, I always think about that, because I actually need my time off, my time with my friends and family, my time with myself to then be a better doctor. And if I don't have that balance, then it will affect either work or life or both. So,
do you get any hatred at all on social media, or more? Do you have any people going, well, why do you have to post all of that? Or are there anyone who's against it at all?
I've had a few like troll comments, and particularly if a reel goes viral. So I had a reel recently that went like now has 1 million views, and it's just
What was it about?
It's just about me and my husband enjoying our day off together. Like, I was literally like, my husband and I are both doctors. We on this sunny Saturday we went for a bike ride. We got a Greg's, we got some coffee, and like I think especially when it reaches more than just your circle, you run the risk of getting trolls and negative comments.
Yeah, definitely.
Yeah, so someone commented like, "Oh, you're a doctor and you're eating Greg's," and I was like, you can be a doctor and eat what you want. Obviously, we advocate for a more healthier lifestyle, but you are allowed to have a Greg's. I'm also going on like a 25k bike ride, so give me a break. And then people were like, "Oh, you're just trying to show off that you're a doctor, and this video is just showing off." And I'm just like, that's just, I think when it reaches people that it's not meant to reach, you might get negative comments. But the people that follow me, I feel like it's a community.
Tight community.
Yeah, and I think a lot of people resonate with what I post and appreciate what I post. So I used to get really upset by negative comments. There was one message I got once that made me cry multiple times. But now I kind of brush it off. I've become a lot more... I just become a lot more resilient with it, and accept.
Is the message something you're willing to share? Or
it was really random. It was just after COVID, and I went to Nando's with my husband. Well, he wasn't my husband at that point, and we Nando's do NHS discount, but we didn't have our cards on us. So I just showed her a photo, and she was like, "Oh no, you could have faked this. You could have, you might not work for the NHS." So I was upset at the time. So I just had a mini rant on my story, which on reflection I shouldn't have done at the time. And someone sent me a really long message about how I was entitled and how I didn't even work during COVID. He was like, "Oh, you didn't actually do that much during COVID, did you?" And I was like, "Yeah, I did." Anyway, it really upset me at the time, but actually allowed me to reflect as well, which I was kind of grateful for in a way. It's good to have people challenging your thoughts and beliefs as well. It kind of helps widen your thinking. And it kind of did make me think, actually, yeah, doctors did work during COVID and it was really rubbish. But actually, there are quite a lot of other professions that had to still continue working during that time. But yeah, I think it was being called entitled that made me feel really upset. But that wouldn't upset me now. Now I would just think this person's having a bad day and they want to have a moan at someone and I'm their target, and I would just delete it. But yeah, that's the growth I've had.
It sounds like you've become quite resilient to blocking out the negativity there.
Yeah, you have to.
I've recently read about the term spotlight effect. I don't know if you've heard about it, but that's pretty much me. Because I know some people, they have the fear of judgment. For me, it's more about the spotlight effect.
Yeah.
And I think someone rightly said, there are two ways we cause harm to ourselves when it comes to questioning whether we should or should not be doing, right now we talk about content creation, but one of the things is caring about what other people say about you, and then the second thing is that thinking that other people actually think about you. And we spend so much of time debating whether we want to do something, whether we want to post that one thing or not. And eventually, yes, maybe you'll have some people who'll see it, laugh, and, maybe talk about it to other friends and colleagues, but then they move on. And sometimes we question it so much that we stop ourselves from doing things. Yeah,
like we were talking earlier about our colleagues knowing about our social media or podcasts and things, but actually realistically they probably do know about it. They've seen it once, they think, "Oh cool, she's doing her thing," and then they carry on living their life, and but it's so easy to think that they just have this huge opinion of you and they really judge you or think of this way because of what you're doing on the side. But actually most people just kind of accept it and move on, don't they?
Yeah, true. And as long as you're doing your job as well.
Yeah.
And it's great that you've got something else going on for you. Whether you want to call it a side hustle or maybe that's your way of escape, and equally it's just something so refreshing to be able to speak to other people and learn about the NHS field.
Yeah, exactly.
What would be your one message to anyone listening to you and thinking about your respective journey, thinking about the 18-year-old Radhika? What would be your one message to listeners?
I think one thing I wish I could say to my younger self was just to enjoy where I am in life at that time. I think it's so easy, especially in a career like medicine, to always be thinking about the future, trying to get to the next stage. And you know, almost like wearing yourself out because you're trying to focus on the future, especially something like medical school. I did that a lot. But actually, I wish I just could tell my younger self to chill out and enjoy where you are, because it's, you know, you can always be thinking about the next part in life. You can always, you know, right now I could be thinking about when I'm a consultant or in 10 years time. But, you know, they say life's about the journey, not the destination. And I think that's kind of what I wish I could tell my younger self to enjoy where you are. Like, you know, for example, at uni, I was around my friends all the time. It was super fun at times. And, you know, I really miss having that proximity to my friends. Even things like being in medical school, being able to do extracurricular things, I never really took advantage of that. You know, I wish I did like Spanish classes and dance classes, but I didn't. I was so stressed about my exams and being ready for the future that I forgot to enjoy the present. So I think for listeners as well, I would really advise to actually check yourself and think, how am I enjoying my present, rather than, you know, it's good to focus on the future. It's good to work hard, but also don't let that be at the expense of your current time. And now, you know, now I'm actually 30 this month. So now in my 29 years of life, I feel like I'm much better at appreciating where I am. I frequently catch myself being like, you know, younger Rads would never imagine even like walking around London with like going to work tomorrow as a paediatric registrar, about to go and record a podcast. But also future Rads will miss this part of life as well. So I kind of have to remind myself that my younger self would have never expected it, but my future self will miss this point in life, because my current self misses past bits of life as well. So, you know, you have to enjoy where you are, but know that it won't last forever, because things always change, but also not focus on the future too much and enjoy where you are as well.
It's such a great month to be recording this podcast. I feel like now that you say you've turned 30 and you would look back at your 20s and go, well, this is what I've done in my 20s. But in 10 years, when you'll be 40, you'll be like, this is what I've done in my 30s. And it's almost like putting that into perspective. You just really want to enjoy the next 10 years because it's full circle, right? You're going to be 40 and then you're going to reflect on, oh, wow, I wish I did so much more in my 30s and enjoy life. Yeah.
No, it's actually really nice to think about the last 10 years and to think about, you know, medical school and my training and also the rest of life as well. It does feel weird that I'm about to be 30. Like, I don't know.
I was about to ask. Yeah, how does it feel?
It feels really like, I don't know. I've personally felt very reflective and very like, how have the last 10 years been? But, you know, even talking to you today has made me kind of reflect on that as well and be happy with how the last 10 years have been in many ways. But, you know, people do say that your 30s are better than your 20s. So I'm looking forward to that.
I turned 30. So I don't know about better, because to your point, like, you just want to enjoy every moment. Yeah. But I hate saying it, but it did feel somewhat of a tipping point.
Yeah.
You just look at life differently. I think your 20s, personally for me, not that this podcast is about me.
No,
but
it's good to hear.
Maybe, I don't know if you would resonate with that or not, but I think looking at my 20s, they felt messy. It was a time to experiment, whether that was like work, relationships, traveling. You kind of get a feel of money because you start to working, but then when you're a student, you don't. There's that funny phase of
absolutely.
You're still at university, you have the time, you don't have the money, then you start working, then you have the money, but you don't have the time. You're still figuring out where you want to stay, where you want to live, for people not from here. Relationships, things will be messy, and I think over time, for me personally, I've just become a bit more grounded, and I've realized that this is what I want in life.
Yeah.
But I may not have it now, but at least I have the vision, I have the goal. And I think like emotionally as well, I feel more connected and I feel very open about how I'm feeling in the moment.
Yeah.
While before I was like, I'm not sure how I feel about this. I don't want to address this. I just feel very connected and grounded in a way.
Yeah.
It's just really weird. But over time, even my friends who've turned 30, we all now in this period where we're like turning 30 or like have turned 30, everyone seems to have different life experiences, and equally I think relationship wise have been quite interesting as well. I've had friends coming out from really long relationships, either because they wanted it or the partner wanted it, and it's that point where I think it just suddenly wakes you.
I like that you said figuring it out, because that's the name of this podcast.
Oh, here we go.
There you go. But no, I completely agree. Like, you just know yourself more the older you get, and that's something that I've begun to appreciate, because, you know, I used to be scared of aging, but now I'm like, actually, it's quite nice to know myself more, to be even more sure of myself, to be confident. Even small things. Like the other day I went for drinks with my friends and I ordered a margarita because I know I love margaritas. Whereas like 5 years ago, I didn't know what I liked and I would just order a random cocktail and waste like £12 on a random cocktail that I didn't like. But, you know, I'm like, I literally said at that point, I was like, yeah, see, now I'm nearly 30. I know what my favourite cocktail is and I can just enjoy it.
Took you
and
29 years
exactly.
to go.
But like, that's such a small example of what we're kind of talking about. You know, you just kind of know yourself more. You know what you like. You're sure of your beliefs. You're sure of how you want to be around people and what you would do in certain situations. And I agree, my 20s were quite messy in many ways. And I think mentally I really struggled, especially in my like early 20s. But I feel much happier knowing I'm in a more constant and content phase of life and things are just more stable and I don't miss the erraticness of
30 is going to be great, and equally I just feel like aging is such a privilege.
It is.
I never thought of it that way, but it's interesting how you mentioned the margarita. I've been enjoying margaritas lately, but I now feel very open about protecting my energy.
Yeah.
So I'm generally an extrovert person, but over time I've become more of a introverted extrovert, or the other way. I don't know how they call it, introverted extrovert or extroverted introvert. But basically, I like my me time. I'll happily be reading a book. If I don't want to go out, now I'm very open about, I'm not drinking much. I'm not going out. I'm just protecting my energy. While before, that would be something I'd
You just burn the candle at both ends. No, I completely agree. Like getting older, I've realised the importance of downtime, me time, and especially as a doctor. Like I used to fill in every free evening, every free day with plans. And now I actually plan nothing time. I plan me time. I plan days for me to just like do my own thing, do my errands. And I really enjoy that. And I think especially when you age with your friends, they also respect that too, because they also feel the same. And like if you were to just say, oh, I don't fancy going out tonight because I'm tired or I don't want to spend too much, people respect that, rather than when we were younger it'd be more like, oh, what a rubbish excuse. So no, I completely agree with you.
Well, on this positive note, and wishing that everyone gets to enjoy the me time after this podcast. Well, Radhika, thank you so much for being on.
Thank you.
Glad we finally met and we got to record this, but it was amazing chatting to you today.
Thank you so much for having me.